So the way dental implants work at Confidental, we have a guaranteed structure that we use. So we always see you to start with to say, look, how can we help you? What's going on? We check the health of your teeth and the gums. So make sure that the rest of the mouth is all completely healthy. Once we know that you're in good health, then we take a 3D scan of your bone. That shows us exactly how much bone height and width we have. So I can plan the longest and the widest implant that will give us the best possible chance of long-term success. We ask you to, we write you a full letter to say, look, this is what implants are, how they work, plus points, negative points, guarantee structure, all of that. So at least you've got a good understanding of what we're doing and what we plan to do and how you can possibly take care of it in the long term. Once you've read through all that and you say, Sandy, look, I understand all of that, let's go ahead. We ask you to come in, we do the actual implant work. So we ask you to come in, numb you up, put the implant in and make sure it's gone in nice and securely. Once it's all healed and we know that the implant's taken with your body and the bone solidified around it, we take some molds, measure up for your tooth and send it to a UK-based dental lab. The UK-based dental lab, they'll make your final dental crown or dental tooth to blend in and match the rest of your teeth. We ask you to come in, have that fitted, show you how to take care of it. And then long term, once that's all done and you've forgotten about all the work that we've done, we just say, look, please come in regularly so we can check the tooth, check the gums, take x-ray of the bone, make sure that we keep that going for the long term and help you keep your teeth and gums healthy for life.